Dr. Bill, let's start off with coronavirus this morning. What's the deal? You know, you see the thing on Facebook the last couple of days. How concerned are you about coronavirus from 0 to 10? Okay, so Dr. Bill Cassidy, physician Bill Cassidy, on that 1 to 10 scale, where are you?
I'm about 6 or 7.
Seriously? Now, are you talking now worldwide, or are you talking just for the USA?
I'm talking worldwide, and I'm talking to the USA and a little bit further out in the future. And our hope is that we can keep it from kind of spreading in the United States until we can learn everything we need to, both to do our best at prevention, our best at diagnosing, and our best at treating. It is spread like the flu. So if you sneeze into your sleeve, don't sneeze into your hand and then shake somebody's hand. Get your flu shot. So if you have some sniffles, hey, we've eliminated flu most likely because you've had your flu shot. But it spreads very easily, very easily.
So it is, pardon me a second, coronavirus is an airborne virus, correct?
Which means when you sneeze and all those droplets come out, or when you kind of blow your nose and you get something from your nose on your hands, even if you don't realize it, it is there, and you shake someone's hands or rub a surface and someone else immediately rubs the surface after you, you serve a plate of food and somehow you contaminate the plate, and somebody ends up getting it on their nose and their mouth. That's how it spread.
Gotcha.
And that's what we need to be careful about.
Is it deadly? I mean, is it a death sentence if you get the coronavirus, or it can be treated,
Not
obviously?
At all. Most people, 99% of people who get it will recover. But because it is spread so easily, a lot of people are going to get it. And so if a lot of people get it, then, and 1% or 2% die from it, then you have more people dying than you wish.
We hear Dr. Figueroa from LSU Health New Orleans saying, if you get any kind of symptoms like this, stay home. Too many of us decide, I'm going to be a great worker and I'm going to go to the office. Stay home, right?
Yeah, and we should be doing that with the flu as well. Because, again, you go and you spread. So that's just a general rule for flu. In the flu season, you get that sniffle. You're right. Stay at home. You don't want to spread it to other people. Take a break a day or two. Take your Tamiflu if you got the flu, and go back to work when you feel better. I'm like you, Aaron. I tend to show up for work even if I don't feel well. But if you think you can spread something to other people, you're not doing anybody a favor.
So the big difference between this coronavirus and basically the flu is just the ease with which it is transmitted, so many more people could come down with it, right?
Well, there's one more difference, which hasn't really been highlighted, but I think I can safely say this. We speak of 10,000 people dying from the flu. Disproportionately, those are going to be the very elderly, folks in nursing homes, for example. Move that down about 10 years, and you pick up the coronavirus vulnerable population. Those folks disproportionately dying are over age 60, and they have some underlying chronic disease. It can affect our younger people. They had a 22-year-old who died in China, a 32-year-old doctor, another 32-year-old doctor. But typically, just take that kind of nursing home population, move it down in age by 10, maybe 15 years. And you have now a little bit more vulnerable population. So I think we, since I'm over 60, that represents me. Typically, it's going to be someone who has heart disease or liver disease or lung disease underlying, but again, not necessarily.
Senator, I hate to ask you this because it sounds like a dumb question, but do I need to go get a face mask? Do people need to go get face masks and have them handy? I mean, we're not to that point yet,
She's wearing
correct?
a coffee filter right now, Dr. Bill.
Can I get rid of the coffee
filter?
filter?
Not taking any chances, and it's a wet one. But please go ahead. Let's treat her question seriously for right now.
No, you do not. Right now, there was one case last night in California that was reported last night that CDC has confirmed of somebody who didn't travel to China and didn't have contact with someone who traveled to China. So the CDC is swooping in right now to find out where they could have gotten it But the CDC and the administration has been working with every state health agency to come up with the testing capability so that if someone comes in and their flu test is negative, they have symptoms that would be characteristic of coronavirus. Maybe they've traveled to China or had contact with somebody, but otherwise the doc is suspicious. They send it off, they get the results, and you'll be diagnosed. And believe me, there's such heightened awareness. So the important thing is not to overreact now, so that if the time comes, it's not the coronavirus that cried wolf. So people will be more prepared to react responsibly when the time comes. So don't react now in a panic. Save that for never panic, but save your concern for when it actually arrives.
Not necessarily to relate coronavirus to what I'm about to say, but if you want to, please feel free. I've been reading a lot of stories last couple of days about how nations, specifically communist China, may be weaponizing things like this. Is that just tinfoil hat stuff, or is there some legitimacy?
I think it's much less likely, and I'll tell you why. When the Chinese first got this, now I'm going to speak a little bit like the doctor and scientist that I am, but I think you can follow. When they first got the virus, they took the virus and they put its genetic code on the internet at the NIH, National Institute of Health here in the U.S. and elsewhere. When our first case happened in the U.S., a traveler returning from China, we took that code and we figured it out. It was basically the same as that which the Chinese posted. They then took a coronavirus from a bat that we already knew. They took the coronavirus out of the bat. They put its genetic code up, and it looks almost the same. So if you had weaponized it, you would have taken that bat coronavirus, and you would have really changed it dramatically. In this case, it just looked the same. So it looks like the kind of natural, this is what always happens. Some virus jumps out of another mammal into human beings. And that's how the flu virus comes around. Mm-hmm. And so it's kind of what you expect to happen when people live right next to animals and maybe, slaughter mammals in a live meat market and get blood on their cut hand and that sort of thing.
Senator Cassidy, the White House sent an emergency request for, I believe, $2.5 billion for vaccines, treatment, and another thing listed was protective equipment. How much of this money will be headed toward Louisiana? And protective equipment, do I need some of that stuff?
Again, that seems to be your focus right now, Aaron.
I'm a little bit freaking out, yeah.
I wouldn't freak out. So the protective equipment's actually going to be more for healthcare workers.
Okay.
The first young person that died was a doctor, 32 years old, an ophthalmologist. What does an ophthalmologist do? He gets about a half an inch from your face to look into your eyes. So the patient's breathing on him, and he was breathing in the patient's, breath, whatever. So you can imagine he got a real high load of the virus. Doctors and nurses continue to be more exposed than others because they're being exposed to more virus. So typically, yes, it'll be coming to our state because we're going to have people at our hospitals. So if you're hospitalized at Willis-Knighton or you're hospitalized at LSU Shreveport, you're going to be, the doctor, and they think you have this, the doctor's going to, and the nurse is going to wear this sort of equipment. There will be other money coming to our state because there'll be dollars coming to states to just kind of increase their surveillance and increase their testing capability, for this sort of activity. And so we are, and then there's other things as well. I want to make sure that our hospitals are prepared so that if somebody does have an issue, that our hospitals are among those equipped to care for them.